Hello, I am Dr. Janice Williams. This lecture will talk about the art and science of being a nurse practitioner and advanced practice of nursing. We will be utilizing content from the Advanced Practice Nursing Essential Knowledge for the Profession, the 5th edition. As we go through this lecture, I hope that you have taken time to read in the textbook from chapters 1 through 3 that will further enhance your knowledge about the information that will be briefly discussed in this lecture. Let's get started. When an individual refers to advanced practice nursing, there are several titles that they may utilize. You may hear people refer to the advanced nursing practice, advanced practice nursing, or advanced practice registered nurses. Either of these terms being used refers to individuals who are either mastered or doctorally prepared in the field of nursing. These individuals can provide direct clinical care. It therefore encompasses the roles of the advanced practice nurse. That includes a nurse practitioner, certified nurse midwife, certified registered nurse anesthetist, and the clinical nurse specialist. Let's first look at the role of the nurse practitioner. When we look at it historically, nurse practitioners, that role came about because these individuals were needed to help provide primary care services to underserved populations. We have theorists such as Lillian Wald, Loretta Ford, and Henry Silver in the 1960s that helped to develop that role. Then in the 1970s, we then got federal funding for programs for nurse practitioners that truly allowed them to focus on those vulnerable populations. Individuals at that time who held the role of a nurse practitioner were able to diagnose and treat only according to their scope of practice. Later on in this lecture, we will talk more specifically about the importance of the scope of practice and why. So how about the nurse practitioner's education, their title and clarification? So in the 1980s and 1990s, NP education moved into the university setting, and it required nurse practitioners to have a master's level education. So thus the master's level programs were developed. Then we started to title them as the advanced practice registered nurses, and it includes those 4 roles that we mentioned earlier. And if you could move forward to the role of the nurse practitioner today, nurse practitioners are required, if they want to clinically practice, to be board certified. They can be board certified in different specialties such as pediatrics, family, adult gerontology, women's health, and acute care. They can also practice in multiple settings and different clinical foci. So if you remember from our lecture last week, the evolution of nurse practitioners started out to meet the needs of the underserved populations in the community. We have since then evolved into when they're nurse practitioners, they can practice either outpatient in the community, they can be in urgent cares, they can also be in emergency room settings, and a diverse number of other settings as well, and obtain different specialties in which they can practice within their scope of practice. So now that we have reviewed the roles and of the advanced practice nurse, let's now transition to talk a little bit about the essentials, the core competencies for professional nursing education. Now, these competencies should, and they do, exemplify the uniqueness of nursing as a profession and reflects the diversity of practice settings, yet shares a common language that is understandable across healthcare professions and by employers, the learner, faculty, and the public. So, what these essentials and the core competencies provide is clarity so that not only the individual who is the advanced practice, but the healthcare system and all the different specialties or professions within that system would understand the uniqueness, but yet the actual, also the complexity of advanced practice nursing and understand what is required of individuals who are advanced practice nurses. So, when we look at the essentials, the core competencies for professional advanced practice nursing, I mentioned that there are 4 spheres of care. When we think about that in collaboration with the essentials and the competencies, those 4 spheres of care for advanced practice nurses is 1, disease prevention and promotion of health and well-being. So you think prevention and promotion, health and well-being. That's all sphere 1. 2 is chronic disease care. 3, regenerative and restorative care. And 4 is hospice palliative supportive care. So when we think about the competencies that advanced practice must hold, they all fall within those 4 spheres of care. Okay? Now, let me mention for you, kind of list out to you, what are the 10 domains that we're looking at for advanced practice nurses. And as you hear these, they're kind of self-explain what is embodied within those domains. Domain 1 for the advanced practice nurse is knowledge of nursing practice. So understanding what is part of your nursing practice, your scope of practice as an advanced clinician, and whatever specialty you may be seeking or gaining knowledge or education for. Domain 2 is that it is patient-centered care. We no longer practice in paternalistic medicine, but advanced practice nurses do patient-centered care, being respectful, compassionate, and coordinating using the best evidence with the patient in mind. Domain 3 is population health. What disease management and prevention may be necessary for the individuals in which you will be caring for. Domain 4 is scholarship for nursing discipline. It is important that as an advanced practice that you make sure that you are practicing scholarship, that you are disseminating your nursing knowledge. That can be dissemination through writings, manuscripts being published. It can be through presentations. It could be through education, but that you're disseminating that knowledge. Domain 5 is quality and safety, that you understand what it is to be providing quality and safe care to your patient and helping to maintain an environment that is conducive to safety for your patient. Domain 6, interprofessional partnerships, recognizing the importance of collaborating with other disciplines, other professionals, not only just physicians, it's social workers, it may be case managers, it may be the nursing team, it can be individuals within the community, even individuals within the setting, whatever your healthcare or your organizational setting is, that can be informatics department, is recognizing that it takes interprofessional partnerships in order to be an effective provider of care to patients. Domain 7, system-based practice, right, is working within the system in which you are employed and making sure that you are being effective and proactive in coordinating the care. Domain 8, informatics and healthcare technology. As we recognize that technology is advancing very quickly, it is a responsibility that advanced practice nurses be educated and knowledgeable and proficient in providing care using informatics and healthcare technologies. Number 9, professionalism at all times, that you recognize what professionalism looks like for your profession, right? As a advanced practice nurse, recognizing and being accountable to being a professional. And number 10, but not the final, like not the last or the least, shall I say, is personal, professional, and leadership development. As you probably heard even before you began this endeavor to become an advanced practice nurse, is we always say that you are lifelong learners, and understanding the importance of that, and even the professionalism of joining your professional organizations, being a part of the collective body to move the profession forward. So, we've talked about the four spheres of nursing as it applies to the essentials. We also talked about the 10 domains. Now, let's briefly list and talk about the 8 concepts of nursing practice. When we think about nursing practice, these concepts include clinical judgment, communication, compassionate care, diversity, equity, and inclusion, ethics, evidence-based practice, health policy, and social determinants of health. I would like to point out that several years ago, the essentials kind of transitioned away from diversity, equity, and inclusion being a single identity, but that it started to recognize that diversity, equity, and inclusion should be fundamental and woven throughout the entire essentials. So it doesn't necessarily stand out on its own, but as you read and begin to understand what the essentials and your competencies require of you, you should be able to see that diversity, equity, inclusion is throughout the entire essentials. And we've already mentioned the 10 domains or major domains of the essentials. So take time to kind of review these, but note that there are 10 major domains, and then we have some sub competencies up under those. Now, there is also an organization called NOF that has some core competencies for nurse practitioners. These are specific to nurse practitioners. It's called the National Organization of Nurse Practitioner Faculty. And their competencies outline clearly what is required for nurse practitioner faculty. They have competencies that include scientific foundation, leadership, quality, practice inquiry, technology and information literacy, policy, health delivery systems, ethics, and independent practice. So if you look or if you think about the competencies that you heard from the essentials from the American Association of Colleges of Nursing, and then you think about the NOF competencies for nurse practitioner faculty, some of them do overlap. Okay, you can kind of see the importance of things like the technology, the ethics, the practice, and knowing your scope of practice. I would like to briefly mention, for some people, advanced practice nursing is not just a master's degree. If you remember from I believe the first slide, it talked about advanced practice nurses can either hold a master's or a doctoral degree. Okay? The AACN formally approved the Doctor of Nursing Practice degree in 2004. This degree, what makes this different than a PhD? This degree is for individuals focused on clinical practice rather than research, which is in contrast to the PhD. It offers the NP student additional education and preparation to meet the needs of complex healthcare systems in the near future. When you think about the Doctor of Nursing practice, you're thinking about individuals who do advanced education. These students are required to complete a DNP scholarly project in order to obtain their degree. Their coursework includes three content areas that is consistent with individuals who may get a master's in advanced practice nursing. It includes that they must have the advanced health assessment, advanced pathophysiology, and advanced pharmacology. Okay? When we think about the advanced practice registered nurse competencies, according to NOF, they must be able to provide patient care, show a knowledge of their practice basic learning and improvement, interprofessional communication skills, professionalism, system-based care, interprofessional collaboration, personal and professional development. These should sound very familiar to you from the first 10 domains that I mentioned. So how does a nurse practitioner approach care to their patient? What makes us different, or what makes us nurse practitioners compared to being physicians for physician assistants? When you think about nurse practitioners, there are some theories that are specific to nurse practitioners to help clarify what and who we are and how our practice is founded. Nurse practitioners also work by what we like to refer to as the 5 A's. We assess, we advise, agree, assist, and arrange. Okay? There are several theorists that have helped to establish nursing as a profession and help with advanced practice as well. We have theorists such as Virginia Henderson, who talks about the 14 basic needs. We got Jean Watson, who talks about 10 curative processes. We have Hildegard Paplaw, interpersonal relations. We have Madeline Leninger, talks about transcultural nursing theory. And we have Imogene King, the theory of goal attainment and mutual goal setting. Some of these theorists may ring a bell to you from your undergrad. Theories help to clarify and for those of us who are practicing in nursing, as well as for those who need to understand nursing at how and why we do what we do. And it helps to validate that how we practice is evidence-based. So now let's talk about the unique role of the nurse practitioner. We, as nurse practitioners, things that make us unique and distinct is that we authentically listen, we demonstrate empathy, we show that we also negotiate with our patients, and we go above and beyond. These are some of the unique roles that we identify as being advanced practice to other roles. Not saying that other roles don't embody some of these characteristics or qualities, but we are saying these are foundational to what we do. When we look at the steward model of nursing practice, you have the nurse practicing, you have the medical model, and then you have the nursing model at the core. So what I want you to think about, medical models are about diagnosing and treatment. Nursing models and the nurse practitioner model is about holistic care. And remember, we talked about the 4 spheres, right? So you got to think about, we look at our patients in a holistic manner. They're not just about the disease process and the treatment. Okay? So let's just leave you with some questions, okay? What was the purpose of the initial role of the nurse practitioner? And does it differ from the role of the nurse practitioner today in today's healthcare system? I want you to think about that. Is the role from when nurse practitioners first originated historically out of a need, right? To meet the needs of the underserved in rural environments, is that still the same today? The second question, who are advanced practice registered nurses? Who are they? What are the masters and DNP essentials? And what are they used for? Why do we have these essentials? Why are they important? Why do we need them? And what do they establish? And can you list any of the essentials and the core competencies? Describe the NP role competencies as identified by NOF and discuss how students can attain basic mastery of these competencies. How can you? What are elements of role transition from RN to NP? What do you need to have? What do you need to do to transition from an RN to an NP? Where are you in that process? What else do you, when you think about the competencies, when you think about the essentials, when you think about what you have heard over the past 2 weeks related to the role of the advanced practice nurse, the role of the nurse practitioner, the role of nurse practitioners in the diverse specialties, the role of the nurse educator, where are you in those processes? What do you need to do in order to achieve your advanced practice nurse? And the last one, the concept of nurse practitionering has been introduced in this chapter. Comment on your responses to this idea. What is nurse practitionering? So, along with what you have read in your textbook, along with this brief introduction, just to kind of get your brain kind of thinking about advanced practice, the advanced practice role, thinking about the essentials according to the American Association College of Nursing and of NOF, the domains that you are required to be able to say that you are, you have learned and you will exhibit. What do you think about those? So again, if any of these questions you are not clear on, I want you to go back to your textbook, read that area, and build on the knowledge that you currently have to solidify your complete understanding of what advanced practice is, what are the competencies you're required to do. And the second part of this session is going to be give you an assignment to help you dig a little deeper. We will discuss that in class.